Welcome to our sonography lecture on renal pathology, part 9 of 14, renal infections for the sonographer. This lecture is going to cover pyelonephritis, emphysematous pyelonephritis, and xanthogranulomatous pyelonephritis. Renal infections occur when there is an upper urinary tract infection, or a UTI. So the upper urinary tract is the kidney. The lower urinary tract is going to be the bladder and ureter. Normally, upper urinary tract infections are an extension of a lower urinary tract infection. Once a patient is diagnosed with a lower UTI, if it is left untreated, it has a really good chance of moving up the ureters and infecting the kidneys. There are also some diseases that can progress to diffuse infection as well. We're going to go ahead and start then with pyelonephritis. Pyelonephritis is an infection of the kidneys, and it's typically seen in conjunction with a lower UTI caused by the E. coli bacteria. Symptoms that go along with all of our infections typically are high fever, increased white blood cell count, fatigue, pain, all of that. Everything that goes along with infection is true for pyelonephritis. On ultrasound, what we're going to see is debris within the collecting system. We might see some loss of vascularity in the cortex, so we want to make sure that we're using our color box and settings appropriately. We might see some focal hypoechoic areas, which represent edema or extra fluid in the kidney. We might see some focal hyperechoic areas, which typically represent hemorrhage or bleeding within the kidney, and we might see this evolve into a renal abscess. So here on ultrasound, we have an example of pyelonephritis. The area that the arrows are pointing to represent a focal pyelonephritis where an infection has occurred. We can see that we've lost the differentiation between the cortex and the medullary, and it represents kind of this irregular hyperechoic area. Here's another example of pyelonephritis where the arrows are pointing to. We can see on the color image then that there's no color really in this area in the setting of a very hyperemic kidney otherwise. So this is classic pyelonephritis presentation. We want to make sure that we're using our color appropriately to show that we are kind of missing an area of color flow. Pyelonephrosis then is an extension of pyelonephritis. So pyelonephritis is the initial infection. Pyelonephrosis means that pus is now starting to form within the collecting system. This is usually secondary to an obstruction and infection. If pyelonephrosis is seen, then this is an emergent finding. We need to get that patient on strong antibiotics, typically IV antibiotics, admitted to the hospital and get a drain in there as well. As far as ultrasound appearance goes, we're going to see a lot of the same things that we see with pyelonephritis, and we're also going to see a renal abscess, which is also known as a renal carbuncle, start to form. So with the pyelonephrosis, that pus starts to get collected, the abscess or carbuncle starts to form as the body tries to wall off that pus. The renal abscess then is going to look like abscesses that we see around the body, including well-defined hypoechoic areas with some internal echoes. So here's our example of pyelonephrosis. We have the collecting system here, renal cortex, and then this is the abscess that is developing with those internal echoes. Typically very thick walls, sometimes some increased vascularity around the outside, but very thick walls with internal debris. Here is a CT then of the pyelonephrosis. We can see the right kidney here, and we can see that thick-walled, kind of irregular shaped abscess or renal carbuncle in the kidney. Our next type of infection of the kidney is called emphysematous pyelonephritis. And you may recall we talked about emphysematous cholecystitis, and it's kind of the same idea. There are bacteria present within the kidney when it is infected with pyelonephritis. And as bacteria are allowed to reside in the kidney, they start to produce air as a byproduct of their metabolism. So that air then is seen within the renal parenchyma. Like it is with emphysematous cholecystitis, emphysematous pyelonephritis is also more common in diabetics, and if we see it This is an emergency cause to do a nephrectomy, which means remove the kidney. On ultrasound, we're going to see, again, signs of infection that we see with pyelonephritis. The kidney is going to be enlarged, and we're going to see bright echogenic lines producing dirty shadowing or ring down artifact. So in this example here, we have the kidney, and we're seeing a little bit of air here and here, and it looks like we might actually have a little bit of air along the periphery here, which is causing this dirty shadowing. Another example of emphysematous pyelonephritis, these lines here are representing bubbles or air within the kidney. So these are linear lines within the kidney representing that air, which is causing a little bit of dirty shadowing from behind it, which is consistent with emphysematous pyelonephritis. Here is another example of emphysematous pyelonephritis. Again, we are seeing those increased vascularity, infectious signs of the kidney. We're seeing an area that does not have flow within it, so that's kind of that pyelonephritis part of it, but it's because we can see these kind of bright echogenic dots within that we are concerned for emphysematous pyelonephritis. Our last infectious process of the kidney is then xanthogranulomatous pyelonephritis. And you may recall this term as well during the gallbladder lecture. We talked about xanthogranulomatous cholecystitis. And what happens with xanthogranulomatous pyelonephritis is kind of the same idea. So there's chronic infections or subacute infections in the kidney that the body is just kind of constantly sending off fighters to. So it's sending its white blood cells, it's sending its macrophages, sending all that good stuff down there to try to heal the kidney. But it just keeps really sending all this stuff down because the patient has these chronic infections or these kind of subacute infections that the body's just always trying to take care of. So this process of constantly trying to fight off these infections leads to a collection of granulomatous material. So granulomatous material refers to those white blood cells, macrophages, all of that. It also causes fat to accumulate within the kidney as well. So the granulomatous material and the fat within the kidney are relatively echogenic. They can kind of distort how the kidney appears. And then the other thing that we often see with xanthogranulomatous pyelonephritis is staghorn calculi. Now, we haven't talked about staghorn calculi yet. I mentioned it in a previous section of this lecture, and that staghorn calculi is a giant kidney stone that fills the whole pelvis of the kidney. And because this is so giant and obstructive and really irritating to the kidney, the cells get irritated, they get inflamed, then they get infected, and then we start this healing process, and it just kind of keeps going the longer that giant stone is in there. And so we can see then how xanthogranulomatous can present with a kidney stone that is constantly bothering the kidney. On ultrasound then, we're going to see a very large kidney, might have a distorted appearance to it. We might see some loss of tissue differentiation, so that means that we can't tell the difference between the cortex and the medulla and the sinus. We might see some cystic spaces that represent fluid being blocked in there from the staghorn calculi, and then we might also see some shadowing from the staghorn calculus as well. So here is an example of our xanthogranulomatous pyelonephritis kidney. We have kind of these fat stranding areas. So we have these bright kind of distorted areas. This doesn't really look like renal pelvis. It doesn't look like medullary. This kind of looks like cortex out here, but now we're seeing these weird kind of cystic spaces in here. So it's really kind of just distorting the whole appearance of the kidney. In this example, again, we've got fluid out towards the periphery. We're seeing very odd echogenic collections of that granulomatous tissue throughout the kidney. In this image, we can see some fluid backed up. And the big part on this one is the staghorn calculus. What we are seeing right here is the edge of the kidney stone, and then this is all shadowing from that giant stone that is lodged in the renal pelvis. So that xanthogranulomatous pyelonephritis then associated with staghorn calculi, fluid in the kidney, and kind of this distorted appearance to the kidney structure. And that is the end of renal infections. Next up, we're going to discuss renal calcifications.